City Clinical Emergency Hospital number 25 is a supporting healthcare institution of Volgograd region. More than 1,000 patients simultaneously can receive medical treatment. Every year the hospital receives more than 30,000 patients. A short time before the hospital gained a second wind, it was completely modernized and renovated. Modernization was held with the support from Sergei Bagnenko, emergency chief specialist of the Russian Ministry of Healthcare, as well as experts of Jonelidze Institute and Sklifosovsky Institute. All emergency centers are concentrated on the base of the hospital: trauma care, burn care, vascular center, toxicological center. The main part of the emergency service is urgent surgery, as well as vascular accidents, heart attacks and strokes. Also, countrywide unique divisions are concentrated here, such as the emergency room and the Department of Multi-System and Concomitant Injuries. Top public officials visited the emergency room at the day of its opening.
Можно подчеркнуть, что это, собственно, у вас самое новое достижение.
In 280, Emergency Consultative Medical Care Department with its Remobile fleet and helicopter ambulance was transferred into the emergency hospital structure. The hospital is a clinical center of the Volgograd State Medical University. Training of specialists and clinical care is carried out by doctors together with colleagues of the Hospital Surgery Department, Hospital Therapy Department, Research and Development Institution of the Clinical Rheumatology of Russian Academy of Medical Sciences, Physical Therapy Department, Anesthesiology and Intensive Care Department of Volgograd Medical University's Advanced Training Faculty, Traumatology and Orthopedics Department, Obstetrics and Gynecology Department. The hospital provides diagnostics and treatment on the following directions: surgery, gynecology, neurosurgery, trauma care, vascular surgery, endocrinology, toxicology, gastroenterology, pulmonology, cardiology, neurology, including stroke treatment. About 9,000 operations are annually performed by the surgeons of the Clinical Emergency Hospital number 25. Most of them are laparoscopic, in other words, which are of low trauma, made with the help of little punctures. Doctors perform surgical manipulations with generally accuracy. Specialists use the latest technologies in their work, which are based on the fundamental developments of Russian healthcare. The following types of surgical treatment are available in the hospital: herniated disc material removal, brain tumor surgery, hip joint replacement, hallux valgus, thyroid surgery, laparoscopic cholecystectomy, inguinal hernia, femoral hernia, umbilical hernia surgery, hemorrhoidectomy, chronic papaproctitis draining, uterine artery embolization, coronary and carotid stenting, arteries of lower and upper limb stenting, laparoscopic gynecological surgery, treatment of rheumatoid arthritis, arthrosis, spondyloarthritis, different types of diagnostics. The advantages of the Clinical Emergency Hospital number 25 are providing with modern equipment for diagnostics and treatment procedures, ultra-modern surgery block. The hospital provides continuous round-the-clock monitoring in the early post-operative period. The implementation of a rehabilitation program developed individually by rehabilitologists is the main factor of the post-operative period recovery. Your personal manager will help you to book a hotel room or rent a private apartment. Also, he will organize a patient meeting at the station or the airport, take care of the transfer to the hospital, provide a SIM card of local mobile service. The hospital provides for the placement of patients in comfortable wards. Wi-Fi is available. There is a canteen with delicious and healthy products, newsstand with fresh press on the territory of the hospital. During free time, patients can walk on the landscape territory of the hospital. There is a picturesque park, the parish of the Russian Orthodox Church. Good equipment, qualified medical staff, respectful attitude to patients, corporate spirit and trusting relationships between staff make treatment and stay at the hospital comfortable and enjoyable. Residents and guests of the Volgograd region can receive highly qualified service at the City Clinical Emergency Hospital number 25 with modern equipment and in comfortable conditions. Our contacts: Russia, Volgograd region, the city of Volgograd, Dzerzhinsky district, Zemlyachki Street 74. For more information, go to the website. For possible contraindications, please consult the doctor. Payment shall be in Russian rubles at Russian Central Bank's current exchange rate. The cost of services is subject to change depending on the treatment scheme selected and agreed upon the patient. Service: herniated disc material removal, $1,100. Brain tumor surgery, starting $1,260. Hip joint replacement, $3,830. Hallux valgus, $780. Thyroid surgery, $765. Laparoscopic cholecystectomy, $615. Inguinal hernia, femoral hernia, umbilical hernia surgery, $538. Hemorrhoidectomy, $490. Chronic paraproctitis draining, $462. Uterine artery embolization, $2,350. Coronary and carotid stenting, arteries of lower and upper limb stenting, $2,769. Laparoscopic gynecologic surgery, $923. Treatment of rheumatoid arthritis, arthrosis, spondyloarthritis, $893. Diagnostics starting from $50.